Thank you, Kate, and good afternoon to everyone. On this presentation, I want to build upon Edson's presentation and really talk about the behavioral characteristics that influence the effects you see within a labor market and what are some of the interventions that countries can use to address them. So throughout the world, there is a tendency for the health workforce to be concentrated in urban areas rather than in rural areas. And as Edson showed us in the example from Togo, that is the same situation on average on a global scale. Although almost half the global population lives in rural areas, they are served by a low percentage of the total nursing and physician workforce. And this is not just a problem of developing countries. High-income countries also suffer from severe geographical imbalances in the availability and accessibility of their healthcare workers. So in order to attract and retain health workers in rural, remote, and other underserved areas of the country, policymakers then need to put in place strategies that effectively address the factors that motivate employment decisions. And these factors are complex, they're interconnected, they are what determine if a health worker decides to relocate to a rural area, whether they will stay or leave, or how long they will stay in that area. While all the factors are context-specific, it matters by country, by region, by type of individual, evidence from many, many countries has shown us that there are a common set of issues that we often see that countries can look to focus on. These are often termed the push and pull factors. Push factors are those that repel an individual from a certain job or a certain location, whether it is poor opportunities for income generation, the living and working conditions, infrastructure, whereas the pull factors mirror the push factors and are those which attract an individual to a certain job or a location. Maybe there is improved career progression, better infrastructure, social amenities, etc. So governments, in order to determine which of the interventions will be most effective to increase accessibility of health workers in these underserved areas, they really must understand the behavioral characteristics that influence choices. And so there are many, and there are some on the slides here, the individual or personal characteristics. Where a person is from, for example, origin from a rural area has shown that those health workers are more likely to return to a rural place or return to their home community. The age of a health worker, if you're early in your career, you may be more likely to accept a position for increased learning in a rural area. If you're further along in your career, you may be less open to it. Same is connected to marital status. The local environment in which you find yourself. The social amenities, the infrastructure, is there adequate housing? Or if you have children, what are the schools? Are they of quality that you would send your children to, et cetera? Within the work environment, what is the situation within a facility? Is the staffing adequate? As many people find in rural areas, usually there are shortages of health workers, so the existing staff often have a work overload and may need to provide services for which they may not have been adequately trained. The equipment and medicines supplies may be lacking in some rural areas, as well as human resource management systems may be less effective as you go further out from the central or regional levels. Health workers give great credence to career and financial incentives. Are there opportunities for professional development? Do they have continuing training programs? What is their career track? Many health workers who have been interviewed have said that working in these rural and remote areas sometimes feels like Siberia, and they feel they may have been forgotten and not selected for further education or for promotions, etc. Finally, the education system. How and where health workers are trained also influence their decisions. In many countries, the training institutions may be located in urban environments. It has been shown that those who have trained, even if coming from a rural area, have then trained in an urban environment, they then may be less likely to return to a rural place once they've become accustomed to the amenities and the different situations in in big cities. As well, how the country's health system works, whether there's a focus on curative or preventive care, if there's a move towards specialization of health workers, then the more specialized you are, the least likely you are able to work at the primary level of care. And finally, the national and the international context determines where health workers work. How the health system is financed and regulated will determine if people will stay or they may out-migrate for a different financial opportunities or career promotions outside in developed countries, as well as the environment within a country, whether there's political and social stability influences workers. So given all this, you can see there are so many factors. They are complex, these social, professional, educational, economic factors. They all influence motivation. And they don't influence in a single way. They're all some ways interconnected. So therefore, the same approach needs to be applied to strategies. There's not one single intervention that you can implement that will move health workers to a rural area. You must have, as the WHO recommends, a bundle or a combination of different incentives and strategies in order to try to get at some of these behavioral characteristics that influence decisions. Fortunately, policymakers do have a range of options and interventions in order to address maldistribution and shortages in rural and remote areas. And the WHO, with many, many different organizations, has done a wonderful job in culling from the literature all the different strategies and interventions that are possible. And in 2010, they launched their policy recommendations for increasing access to health workers in rural areas. And as you can see from this list, there are 16 examples of interventions divided across the areas of regulation, education, financial incentives, and personal and professional support. And you'll note that there's a roundtable in the breakout sessions, which we will go into more depth looking at these different recommendations and possibilities that policymakers have. And so how do you take those possible examples and how then do you go about developing a recruitment and retention strategy? So one of the most important component is the situation analysis. There is no one-size-fits-all solution. So this, looking at the specific labor market in that country, identifying those specific health service needs in the different regions and communities, and really having an understanding of what health worker preferences and needs are, really having an idea, a better sense of these motivational factors which I just described will lead to more effective choices. As well, the criteria of what will be effective, what will be economically feasible, what is acceptable politically and socially, all of those as well are context specific. And finally, I make a plug for the monitoring and evaluation. One of the issues that we find most lacking in the research is to get a full understanding of which combination of the interventions in the different contexts are really having the most effect. And at times that can be really hard to pull out, and there are many different things going on. So really having a focus on monitoring and evaluation as even you begin the design process is critical. And so how would you go about eliciting health worker preferences? Kate mentioned early on the discrete choice experiment. That could be one powerful option to understand what are the driving motivational factors that move health workers. And then this method allows you to give a value to those different factors and help predict how different groups of health workers may react to different policy interventions. What the model does, and inherent to the statistical modeling, is it allows you to identify the trade-offs health workers are willing to make. In other words, as a health worker, would I sacrifice my social amenities and my living conditions and work for a given number of years in a rural area if that means when I complete my service, I have a promotion and I'm eligible for further training, or I receive increased salary for that position? So those are the types of factors that this method will allow you to look at. And there's also a roundtable session in the next part that will go deeper into what is discrete choice experiment and how it looks and how you can use it. And so an example from Laos of how they were able to bundle the different types of interventions and see a little bit of success early on. So based on the results of a discrete choice experiment used to help them develop a new recruitment and retention policy, the government decided to use a 3-year compulsory service scheme, which after 3 years of working in a rural area, all health workers then would receive their license to practice. And in exchange for these 3 years, and to motivate high quality services while they're working in the rural areas, they are provided with increased salary, eligibility for further training, a permanent position in the civil service, as well as housing and other financial allowances. And so as a result, in the very first phase, they were able to place 400 health workers in about a third of the districts in the country. A similar case in Mali, were able to bundle different education, financial incentives, improving the living and working conditions, and importantly, providing the professional support, having an association of health workers where you felt you had peer-to-peer contact, mentoring to improve your job. They were able to place over 100 rural health workers in rural areas over a 10-year period, on which on average health workers stayed for 4 years. So this was another study from WHO. And just to provide some resources, because I was only able to give you limited information, these are some of the resources that CapacityPlus, the World Bank, and WHO, we have been working on to help provide further guidance on recruitment and retention. So you have access to these, and the sessions in the roundtable will also specifically go into these details. Thank you.